Hi friends, today we are going to discuss another important topic of the antimicrobial system, that is aminoglycoside and tetracycline. The first one, aminoglycoside. The examples of the aminoglycoside are streptomycin, gentamicin, neomycin, cysomycin, tobramycin, amikacin and kanamycin. You can remember any one of these whatever you want, but in MCQ any kind of drug can be asked, so just read it once. Let's move to the mechanism of action of the aminoglycoside. When we take the aminoglycoside in the body, means if we take streptomycin or gentamicin, there will be the entry of the drug into the bacterial cell by using the oxygen. Oxygen is required for the entry of the any kind of aminoglycoside into the bacterial cell. Once the aminoglycoside is inside the bacterial cell, it will bind to the 30S ribosomal subunit. It will go into the cell, and in the cell it will go into the nucleus, and inside the nucleus it will bind with the ribosomal subunit, 30S ribosomal subunit. By binding to the 30S ribosomal subunit, it will perform two actions. The first one, that it will inhibit the initiation of the protein synthesis. Due to this, protein will not be formed, and as we know, the protein are the building block of the any system. So protein will not be formed, so bacteria can't develop, or bacteria will not grow or multiply. The second action is it will cause misreading of the codon, and by misreading also it will cause the premature termination of the protein synthesis and insertion of the wrong acid into the growing peptide chain. Will also the basically the same thing, it will not cause the protein to form. There will be a formation of a defective protein if any kind of wrong peptide is added into the sequence of the protein. Then that defective protein will be incorporated into the bacterial cell membrane, and alter permeability and disruption of the cell membrane will also happen. So this is the way aminoglycoside will work, and they are bactericidal in nature. That you have to remember, that they are the bactericidal in nature. So this is the mechanism of action of the aminoglycoside. सिंपली सेल के अंदर गए, 30S राइबोसोम को बाइंड किया, प्रोटीन सिंथेसिस को इनिबिट किया, एंड कोडोन का सीक्वेंस मिसरीड करके प्रोटीन सिंथेसिस को टर्मिनेट किया, और आइदर उसमें रॉन्ग पेप्टाइड को डाल दिया. दैट विल लीड टू द फॉर्मेशन ऑफ अ रॉन्ग पेप्टाइड, रॉन्ग प्रोटीन. दिस इज द बेसिक मैकेनिज्म एक्शन ऑफ द aminoglycoside. Then after that, the common properties of the aminoglycoside can be asked sometime. It is given in your Balani also. So common properties are also important. They are very easy to remember. The common properties of the aminoglycoside are such that they are polar compound, hence poorly absorbed from the GI tract. The oral tract is not suitable only, but they are very poorly absorbed from the GI tract. Okay. They are administered by the parenteral tract, intramuscular, intravenous. Thus route are preferred for the aminoglycoside because it is not absorbed that much easily. So these are the two common properties. Then after third one is the mainly distributed into the extracellular fluid and poorly penetrate into the CSF. Third one. And fourth one is not metabolized in the body, not absorbed in the body, not metabolized in the body, and excreted unchanged in the urine. Means it will excrete in the same form you have taken, that it is excreted unchanged in the urine. Then the sixth one is bactericidal action against gram negative aerobes, then more active at alkaline pH. This can be asked in your MCQ, that aminoglycoside are more active at alkaline pH. After that, it can cause ototoxicity and nephrotoxicity also. Then partial cross resistance among them is present, and transport into the cell require oxygen, as we see. So these are the common properties of the aminoglycoside that are important to know. So just read or go through them once. After common properties, the adverse drug reaction are the ototoxicity. 8th cranial nerve damage happen into ototoxicity. They can be of two kinds: vestibular damage or cochlear damage. If there is a vestibular damage, the patient will feel intense headache, dizziness, nausea, vomiting, nystagmus, vertigo and ataxia. And in the same case, cochlear damage if happened, then the patient will feel tinnitus and deafness. So this is the ototoxicity. Then after that, the next adverse effect is nephrotoxicity. After nephrotoxicity, there is a neuromuscular blocking, hypersensitivity reaction, and in pregnancy may cause ototoxicity to the fetus. So these are the some different kind of adverse drug reaction which we are seeing in the aminoglycoside group of drugs. So these are the adverse drug reaction. Then therapeutic use. Now you are familiar with the therapeutic uses of the cotramoxazole, fluoroquinolones, then that penicillin, then cephalosporin. Now it's the time for the aminoglycoside. First three: urinary tract infection, respiratory tract infection and GI tract infection. Urinary tract infection, pyelonephritis; respiratory tract infection, pneumonia; gastrointestinal tract infection, peritonitis. You have to remember it in a very quick manner. Now you are mastering it. First three. Then second three, there is no STD and no gonococcal infection in it. Instead of that two, the one is only present here, that is meningococcal infection. Okay. After that, septicemia is the again therapeutic use of the aminoglycoside. Then the different are tuberculosis, plague, brucellosis, tularemia. These are the different uses of the aminoglycoside. Remember, like TB and BT, brucellosis, tularemia. Then P is the plague, and you are already familiar about them. So these are the uses of the aminoglycoside. So this is all about the aminoglycoside, the the mechanism of action, common properties, adverse drug reaction, therapeutic use, everything. After aminoglycoside, now we will see the tetracycline. Tetracycline is a short topic. Tetracycline, the example of the tetracycline is tetracycline and doxycycline. The mechanism of action of the tetracycline is very much similar to the aminoglycoside. That is, the tetracycline when taken in the body, then it will actively taken up by the susceptible bacteria, and it goes into the bacterial cell, and after going into the cell of the bacteria, it will reversibly bind to the 30S ribosomal subunit. By binding to the 30S ribosomal subunit, it will prevent the binding of the amino acid tRNA to the mRNA ribosomal complex. By this way, it will prevent the addition of amino acid to the growing peptide chain. So as there is no amino acid, there is no formation of the protein. That is why it will inhibit the bacterial protein synthesis, and so it is bacteriostatic in nature. You have to remember it that tetracycline is bacteriostatic. Every 1 or 2 year tetracycline MCQ are asked that about it is bacteriostatic, stridal, or what kind of drug, though it is a bacteriostatic drug. Then the adverse drug reaction of the tetracycline are hypersensitivity reaction like skin rashes, urticaria, itching, dermatitis; GI tract infection, nausea, vomiting, diarrhea, abdominal discomfort, epigastric stress; phototoxicity, like sunburn like reaction can be seen, and pigmentation of the nails can be seen in the phototoxicity. Hepatotoxicity can also be seen, acute hepatic necrosis. Then renal nephrotoxicity can be seen, Fanconi syndrome. Then superinfection, effect on bone and teeth is something like brownish discoloration of the teeth will happen. Affect linear growth of the bone. This is another side effect, and intracranial pressure will increase. These are the various adverse drug reaction of the tetracycline. After adverse drug reaction, we will see the therapeutic use. There are something different in the therapeutic uses of the tetracycline. It is not that conventional therapeutic use which we are seeing from the cotramoxazole, penicillin time era. Okay, so these are different. You can remember the therapeutic use by A, B, C, M, R, P. That is acne, amoebiasis; B for brucellosis; C for chlamydial infection, cholera; and MRP is mycoplasma infection, malaria; R for rickettsial infection, and P for plague. Okay, A, then B, C, M, R, P. Leprosy and filariasis are also included. So this is the way tetracycline can be studied. The tetracycline, mechanism action of the tetracycline, adverse drug reaction of the tetracycline, and therapeutic uses of the tetracycline. So this is all about aminoglycoside and tetracycline. Just go through it and frame your own question. So frame your own answer in a great detail and vast in a theoretical manner, and just be prepared. Thank you.